residents informed throughout certainly this very difficult time, and which is without question the most significant winter storm in our city's history. Over the past several days, every part of our system, our infrastructure, our equipment, our people, notre infrastructure, notre équipement, notre monde, has been pushed to the limit. On est au bord de notre limite. We're talking about a large-scale logistics operation and has been far from business as usual. That is why I'm joined today by key leaders who have been part of this coordinated response from the beginning to help illustrate the level of planning, coordination, and decision-making that has been happening behind the scenes to get our city moving again. Joining me with a number of councillors, Councillor Labbe, Councillor Fortin, Councillor Signoretti, Councillor Sizer, Councillor McIntosh. I got everybody? Yes, thank you. Perfect. Here, thank you for joining me. As our CEO, Sherry Linterman, will say a few words as well. Ball, Fire Deputy Chief Nathan Mullen, our GSPS Inspector Bob Norman will say a few words as well, and really happy that HSN President Chair David McNeil is with us as well. Because what you'll hear is how the coordinated response of how we were able to manage within the first hours and then what's coming up next. People often hear me talk about the challenge of maintaining more than 3,600 kilometers of lanes of roads. Now, layered on top of that, nearly 2 feet of snow in many areas, even more when you count the snowdrifts more than 5 feet high in some areas across that entire network, and layered on top of that are hard crust of ice. We're effectively clearing a path the equivalent of here to Vancouver, British Columbia. And in doing so, we are managing millions and millions of tons of snow. C'est l'ampleur du défi auquel nous faisons face. Dès le départ, notre intervention a été coordonnée et basée sur des priorités claires. In the first 24 hours, our focus was very clear: supporting emergency response. Plows were deployed alongside police, fire, and paramedic services to ensure they could reach residents in urgent need. At the same time, maintaining access to Health Sciences North was a top priority. We will hear stories of how this collective, coordinated response saved lives, ensured our most medically vulnerable received the care they needed. So, ensuring that frontline healthcare workers would get to work, and that patients as well, including those requiring dialysis and other critical care, could access life-saving services was absolutely essential. This was a deliberate and coordinated decision, and it's important for the public to understand that. HSN triaged the personnel they required, so on Monday, plows were sent to ensure they made it to work, thus HSN remained open and operational. The consequence of prioritizing emergency response and critical infrastructure in those early hours is that not all resources were immediately dedicated to residential road clearing, but that decision helped ensure that lives were protected. The plows that were deployed, visibility was reduced to near zero in the early hours, and tens and tens and tens of pieces of equipment. I think we were at probably 30 to 40 pieces of equipment that were stuck, including 12 buses on Monday morning were stuck in transit. That's how Monday started. And so extracting them was a top priority. Only once we were confident in the operational capacity of our emergency services, the focus shifted to opening as many roads as possible across the city. In fact, Tuesday was the first full day where crews could focus primarily on residential streets after those initial efforts to support emergency response and critical services. Les travaux se poursuivent 24 heures sur 24 et toutes les ressources disponibles ont été déployées. Another factor at play is that traditional plows have not been enough. We have had to rely on loaders and graders because of the weight and the volume of the snow. And they have also been getting stuck, even these graders and loaders, which triples the usual amount of time to remove the snow and is very complex work. On top of that, we had abandoned vehicles, some parked on the streets, nowhere to go because they couldn't get into their own homes because it was full of snow. So that's the challenge that we had. And to give residents a sense of progress, we are now approaching full first pass coverage across the city, with conditions continuing to improve steadily. We have some challenging areas of our city. The southwestern area is being completed as we speak, and equipment got stuck there last night and even before. And that's a major issue that we are seeing because of that volume of snow. Also, the next challenge that we have is certainly our laneways that we are focused on as we speak as well, and our sidewalks. Major challenge of our sidewalks to bring them back to par. The amount of snow The equipment that we have does not push that snow and the size of that snow, certainly in our sidewalks. Donc, une fois l'accès routier établi, nous porterons davantage attention aux trottoirs et aux voies piétonnières. I want to take a moment to recognize those crews and everyone behind the scenes that have been working non-stop since Sunday. Ils ne font pas que déneiger les rues, ils accomplissent un travail exigeant pour permettre à notre ville de continuer à fonctionner. They are doing the hard physical and mental work required to keep this city functioning. And they deserve our thanks. And they deserve our respect. They have been going non-stop since Sunday. They are tired, but they keep going. And I think that we need to recognize that, because from the stories that you'll hear, our road crews are the heroes that certainly have been able to keep our city operating. And to the people of Greater Sudbury, I want to thank you. La population du Grand Sudbury, un grand merci. We have seen neighbors helping neighbors, people clearing snow for others, checking in on older adults. It makes me incredibly proud and honored to be the mayor of this city, knowing at the end of the day, that's what the people in this community are about. C'est ça une communauté. I also want to acknowledge something, that it is the frustration people are feeling. Nous savons que la situation est frustrante. We hear that. With one lane done, the snow we will be pushing again on driveways. We will need to once again clear the front of driveways. We are not done our work, and there's many more days of work ahead. When we are through this, we will take a hard look at our response plan, the technology we use, the equipment, and look to improve. But right now, our focus is on the work in front of us, so we are asking for your continued cooperation. Because the truth is, getting through a storm like this takes more than equipment. It takes a community. It's people helping people coming together. That is exactly what we are seeing across Greater Sudbury, and I want to thank everyone for that. Un grand merci, Miigwech. I will now turn it over to our CEO to provide some more in-depth info on the status of services and
Good afternoon. In addition to our almost 200 winter control staff working around the clock since the weekend, we have assigned employees from parks, engineering, construction, housing operations, facility maintenance, and other areas within our organization to support our response. Our team of fleet mechanics and personnel have also worked nonstop to keep equipment running well beyond normal operating parameters. As work continues, we continue to build capacity with the support of over 15 contractors in this community, nearly doubling the number of contractors that we would normally use to support winter operations. We're also currently doubling the pieces of equipment that are out there clearing the snow, up over 160 to our regular 80 pieces of equipment. We've even resorted to some unconventional measures, including the use of snow machine groomers, thanks to a generous offer from the Sudbury Trail Plan. In terms of a progress update, we're nearing completion, as the mayor said, of a first pass on all residential roads, and we've begun the process of widening roads. We have crews working to remove the large windrows at the end of driveways where possible, although it does take time to get to all of those. We have also started clearing laneways and cul-de-sacs. We anticipate this work will take a few days because, once again, traditional methods are not working, and we have to really pick up the snow, move it, and bring it somewhere else. So we're using different equipment and an entire team of contractors just for this work. We know there's still a lot of work ahead of us, as we still need to address the large snowbanks once all the access has been restored, and we'll turn our attention as well to bus stops and sidewalks in the coming days. Fully addressing this significant snowfall will likely take weeks, but we're actively working towards a return to normal, prioritizing resident safety and leveraging all options available through contractors, neighboring communities, and other city departments. We'll continue to provide updates to residents via our communication channels, including the media, thank you for being here, our website, and social channels. Finally, I'd like to echo the mayor's notes about the tremendous efforts by city staff and the support from various contractors across the city. Thank you to many members of our community who really stepped up and helped your neighbors. And thank you for your patience as we prioritized life safety and emergency services in our response. To give you a bit of an example of some of the stories of how prioritizing life safety and emergency response really happened. I'd like to bring Chief Archibald up to share some of the experiences with you. Chief.
Good afternoon. So I can tell you that from the afternoon or noon on March 15th until 8 a.m. on the 18th of March, paramedic services responded to 306 emergency calls. And through planning and good decision making and consultation with fire services and our emergency management team, we made the decision early on March 15th to strategically place plows at key emergency services stations, both downtown and in the outlying areas. And I can tell you that that decision to have key infrastructure assets available that could help paramedic and fire response and police response made the difference. And out of those 306 calls, we've already done an initial audit, and I can tell you that there was no impact associated with the delay to get paramedic resources or to have care delivered in a timely fashion. We did have, though, about a dozen or so ambulances at periodic times get stuck. We were fortunate that we had additional staff that we put on the road both Sunday, Monday, and Tuesday in vehicles, 4x4 trucks, and extra ambulances to help pull out our ambulances and to help transfer care. I would like to highlight, though, that the community really stepped up. We had paramedics parking their ambulances and walking in to deliver care. We had community members in Jeeps and trucks pick up those paramedics and help them get to the residents. We deployed our ATV Gator, which is a John Deere outfitted ambulance on tracks, and we actually responded to 3 separate calls where we couldn't get a plow into that house or the asset would take too long. By Tuesday, we were able to release those plows so that they can continue to plow in the community, and we put a process in place at every call that we needed a plow. Our supervisors would contact the road supervisors, and that plow would then link up with the paramedic or fire truck and get us into the community. So while I understand the frustration of roads not getting plowed, mine only got plowed yesterday by noon. I understand, though, and I just want to reflect on those decisions did save lives. And, we've had everything from obstetrical calls to doing house calls to help picking up the most vulnerable people. And it really is a community coming together. We had patients that were, injured and couldn't even get out of their own driveway. And we had supervisors and paramedics responding all over the community. We had paramedics sleep at our headquarters on the first night because they couldn't even go home. And so in closing, I just want to thank our paramedic team and the roads team for coming together and helping out this community. It truly is an amazing place to work. And I can tell you in my 27 years of being in this community, I've never seen a snowfall event to this magnitude. So thank you, and I'll take questions afterwards.
Thank you, Chief Archibald. Maybe we'll follow that up with our friends at HSN, and then we'll have GSPS speak. And so I'll ask Mr. David McNeil to say a few words if you will do so. I appreciate it. Thank you.
Good afternoon. Bonjour, Annie. Over the past several days, our region has faced an extraordinary weather event, yet essential patient care and emergency services at our hospital continued, thanks to a remarkable and coordinated community response. So on behalf of the board and the senior management team at HSN, I want to express my sincere gratitude to the staff, the volunteers, the learners, and physicians who made extraordinary efforts to reach the hospital. Many snowshoed, some skied, some snowmobiled, many carpooled, and several walked through severe conditions so that our patients could continue to receive the care they needed. I spoke with one nurse in our critical care unit who walked 8 kilometers to get to work just to ensure that care would continue to be provided. Their determination and sense of duty is truly, truly inspiring. We are also so profoundly grateful for the exceptional partnership and leadership of the City of Greater Sudbury. Their coordinated emergency efforts, including priority road clearing, transportation assistance, and real-time communication, ensured that on-call physicians, such as anesthesiologists, orthopedic surgeons, general surgeons, and many specialty surgeons, as well as obstetricians, were able to safely reach the hospital. This collaboration played a critical role in maintaining our ability to deliver urgent and life-saving care throughout the storm. Our thanks also goes to Sudbury EMS and all of our first responders, whose commitment to patient care was extraordinary. Their ability to navigate treacherous conditions and ensure patients reach the hospital safely exemplified true professionalism. One story shared with me involved a patient who had to be transferred between multiple ambulances when the vehicles became struck along the route, yet the team persisted, coordinating seamlessly to ensure that the patient arrived safely for his care. This is extraordinary teamwork and a powerful example of the dedication shown across our community. We would also like to extend our heartfelt gratitude to private citizens and local taxi services who stepped forward to assist healthcare workers with transportation. Their generosity made a direct and meaningful impact on our ability to maintain essential services. So to everyone who contributed during this challenging time, thank you. Your collective efforts made a profound difference for our patients, their families, and the entire Northeast region. Thank you.
Thank you, David. If I could ask Inspector Bob Norman to come up for GSBS. Thank you for being here.
Good afternoon. Bonjour, Ani. On behalf of Chief Cunningham, I want to begin by expressing our sincere appreciation to the City of Greater Sudbury for leading the Emergency Operations Center through this historic weather event. The level of coordination, communication, and problem solving demonstrated over the past several days has been exceptional. It played a critical role in ensuring the safety of our community. Critical role in ensuring the safety of our community. I want to also acknowledge and thank the partners at Greater Sudbury Paramedic Services, Greater Sudbury Fire Services. Throughout this event, they worked seamlessly alongside police responding to emergencies in extremely challenging conditions. Their professionalism and dedication reflect the strength of our emergency response team and our shared commitment to this community. This is not a situation any one service manages alone. Through the Emergency Operations Center, there was strong coordination between police, fire, paramedic services, and every facet of the municipality. That collaboration is what allowed us to navigate a complex and evolving situation safely. This event is exactly why we invest in training, coordination, and incident command, so that when something like this happens to our community, our members are ready to respond in a structured and effective way. To the residents of Greater Sudbury, simply put, thank you. Your patience, your understanding, your cooperation made a meaningful difference during this event. We recognize how disruptive these conditions were, and your willingness to follow advisories put out by both the police and the city, adjust your plans directly supported the ability of first responders and road crews to do their work safely and effectively. I also want to take a moment to recognize the many frontline workers who kept this community functioning under circumstances none of us will soon forget. Our plow operators, city crews, contractors, and independent operators worked around the clock, often in whiteout conditions, to restore access across the city. At Health Sciences North, staff remained beyond their scheduled shifts to ensure continuity of care, while others made their way in through extremely difficult situations. Behind the scenes, City 311 operators and our GSPS communicators managed constant demand, ensuring accurate information flowed to both the public and emergency responders. Transit operators also played a critical role a critical role continuing to move essential workers and emergency responders when traditional transportation options were no longer available. This honestly speaks to the strength and character of our community. Turning now to our police operations over the past several days. Call volumes directly related to the storm remain minimal. We received a small number of calls involving vehicles becoming stuck on roadways. In those cases, individuals were advised to leave their vehicles when safe and make their way home on foot. I can tell you on the early onset of this weather event, our officers were out moving and transporting individuals that became stranded during the weather event. From Sunday evening to Monday afternoon, there were 3 motor vehicle conditions where police were dispatched. All other non-emergent collisions were referred to our collision reporting center with self-reporting once it reopened. On Monday, there were 82 calls for service. This is significantly lower than our traditional call response on the daily of 151. Of those, 16 were urgent or emergent, involving immediate or perceived risk to personal or public safety. In those moments, we relied on our road services and plow crews to get us to those calls. 5 of those calls were to assist paramedics. Throughout the entire event, our mic is falling here. Throughout the entire event, our primary operational focus was maintaining safe, adequate, and effective staffing levels. To support that, we made the decision to temporarily prioritize essential and emergency calls only until those conditions improved on Tuesday. As roads opened and visibility improved, we began addressing non-emergency calls in a systematic and safe manner, taking into account roadway accessibility and operational readiness. We are happy to report that operations have returned to normal with minimal outstanding calls for service. In closing, I want to extend our sincere thanks to all frontline workers, emergency responders, and road crews who worked under extremely difficult conditions to keep this community safe. And to the residents of Greater Sudbury, thank you for your patience, your cooperation, and your continued support. This was a challenging event, but it also demonstrated the strength, resilience, and unity of our community. Thank you. Merci. Miigwech.
Thank you, Inspector Norman. So that concludes the this portion. The press conference will be